Hello everyone. March for me is always about women. With the International Women's Day, we celebrate women in this practice every day, but particularly in this month, I do think about wellness and general health. And of course, that's very much affected by hormonal changes. We as dermatologists see that all the time. We talk about hormonal changes, and boy, am I just beyond excited to have somebody new in our dermatological life. Dr. Miller and I met at our new Decatur location, which is a fantastic office, and I am so thrilled that my staff connected us. And welcome, I'm so happy that you're here, and I would love for you to introduce yourself and your practice to all of our patients and beyond.
Well, I can't thank you enough for having me here. I am Dr. Taniqua Miller, and I'm the founder of Revival Women's Health, located in downtown Decatur, Georgia. My practice focuses on the midlife health for women. So when I think of my ideal patient being that woman over 40 who's navigating some of these hormonal changes, that is the person that I care for. I'm a gynecologist actually by training, board certified gynecologist, and also a certified menopause specialist over the past decade. And so I've seen just how profoundly the menopausal transition can be for my patients, and really have decided to hone in on that demographic.
And now you know why I'm so excited, because I do really think that what you do in your practice aligns with many of the issues that my female patients face. And in our practice, we do see whole family, we do see different ages, but it seems that particularly in my personal practice, I see the women before menopause and as they go through menopause for many different dermatological reasons. Tell me a little bit about your approach to a patient when they usually present, when they seek you out. What's the typical workup?
So the vast majority of patients that I see, they're done with their childbearing, and so their traditional OBGYN practices no longer seem like a fit. They'll come and they're starting to experience what are considered very early signs, the early perimenopausal symptoms, namely sleep disruption. They might also start noticing some skin changes, namely acne, hair loss, which can be really subtle, and most times when they're interacting with their general practitioners or their gynecologists, it's almost as if you're in your early 40s, you're stressed, you're raising children and all of those things, and they don't really feel heard. And so they come to see me as a menopause specialist to explore what other factors can be going on, and could this in fact be hormonal? For the vast majority of my patients who come to see me, I say yes. We know that perimenopause, there is a long length of time that we go through perimenopause, and it's broken up in that early perimenopause and that late, which has a little bit more of a defined character to it. But that early perimenopausal time is when we start experiencing those symptoms that make you feel like you're not yourself. Your skin is changing, your sleep is changing, your body's changing, your mood is changing. And it can be so subtle and overlaps with so many other things that you're carrying as a midlife woman that it makes it really confusing. And so this is a space for them to be able to explore that a little bit.
And you're speaking my language, because you know we're talking about skin changes and hair loss. We call ourselves the detectives of medicine, because that's when our referral comes. Obviously, medical exam. Tell a little bit more about that.
So a lot of it is history, believe it or not. 80% of the time, I can tell what's happening with a patient for their hormonal transitions based on history. There are certain times when I do want to do some laboratory testing specifically, because there are some great mimickers of perimenopause, especially in those patients who are below the age of 40. If I have a patient who's noticing skin changes or mood changes or skipping menstrual cycles under that age, I have to evaluate for other things like thyroid disease or even conditions like primary ovarian insufficiency, because my treatment goals are different. But after the age of 40, if I have a patient exploring that, labs, especially if they're having normal menstrual cycle, will be considered normal. And I cannot tell you how many times patients will have a panel of labs and be told that it's normal, but it's not. The symptoms that people experience are really the delta or the change in their own hormonal makeup. And so while it may be normal on a lab panel, it may not be normal for them, and they're starting to experiencing those subtle changes early on.
So once you know where they are, whether it's based on history or blood work or a little bit of both, what's next? What's the next step?
So we always focus on goals. I always like to center and anchor my visits on what are the patient's goals. And depending on what we want to focus on, that's how I will usually address it. So for some patients, they want complete suppression. They don't want to cycle anymore. They're like, I don't want to bleed anymore. I don't want to deal with any of that stuff. We go down one pathway. I have some patients that are like, I just want a little supplementation. We go down that pathway, recognizing that over time, this very dynamic process, the needs and goals will change. And so it's that constant dialogue back and forth using their goals as like the North Star of their
Sure,
treatment plan,
sure.
that we do back and forth.
And typically you'll see a patient and then follow up within a month, or what's the typical rhythm?
Kind of the
to
cadence. So after that initial visit, in my initial visits, I spent a really long time with my patients. We spent over an hour together, really kind of getting to understand what it is and really planting education, but also that treatment plan and that North Star goal that we talked about. Then depending on what we start, I usually will have a patient come back between 2 and 3 months to check on things, make adjustments. And then here's what happens. A lot of my patients, once they start feeling better, now we're exploring cardiometabolic health. Now we're exploring sexual health and wellness and intimacy. And so that kind of takes us on a whole nother pathway, but it's really making the person feel heard and feel better before we can even get there.
I mean, I think it's such a multifaceted approach, which is what really resonated with me. And, you know, we, as I've mentioned, and we talked a little bit, have such a broad spectrum of treatments that we offer for women that are hormonally changing, again, because of pigment, because of breakouts, because of dryness, because of hair loss, growth changes. So we're excited that we can complement the recommendations that you have. But what are your thoughts about supplementing with hormones? And if so, what is your typical recommendation?
This is a great question. And again, it anchors again on those goals. But in general, if I have a patient who's starting to experience those early symptoms of perimenopause, we know that it's going to be progressive. And the way that I think about it is that your ovaries are going to be doing its thing, right? The hormone levels are going to decline over time. But we all have a threshold. So the goal of therapy is once the ovary production of hormone dips below that threshold, is to supplement with hormones to get you back above that threshold. And it's so different for every patient. What I try to impart to my patients is that over time, as you continue going through this menopausal transition, it's important to understand that we need to then adjust that supplementation, which may mean increasing doses. And it doesn't mean that your body did anything wrong. It doesn't mean that the treatment has failed. It just means that we're progressing along. And in order to keep you comfortable at that same level, we just have to supplement more.
And you know, I mean, I think we do change, so the treatments, of course, would change as well. Well, I think that it's all such an individualized approach, and I love the approach of your practice because it's not a typical a practice as is. So let's share with everyone, you know, how you typically encourage patients to join into your practice.
So it is a concierge medical practice. I joke and say this is my solution to how we think of prenatal care, how you have 10 visits over the course of the year and you have someone closely following you. It's the same thing for midlife healthcare. And the concierge model, it's an annual membership where patients come in for their initial intake. We do a pretty comprehensive panel of labs that we then meet and discuss. And if we need to bring in our colleagues from dermatology or rheumatology or endocrinology, we bring them in based on my own connections that we built over time in the practice. What's really special about this is that the practice is built so that we have multiple touch points over the course of the year because this whole process is very dynamic. We're not just dealing with hormones, but we're also dealing with cardiometabolic health and assessing our risk for cardiovascular disease and brain health and the like, or intimacy and wellness and making sure that we are paying attention to that because as a gynecologist, I hate to tell you, my colleagues and I, we don't do a really good job of focusing on that, and it's an important part of this midlife health journey. And so my patients who come to the practice are really looking for that partnership. A patient described it as like, I don't want to be the quarterback of my health. I want somebody else to help me, and that is what the practice does.
Well, you've heard it all. I mean, I think this is such a beautiful, beautiful approach to the journey that so many women take, you know, and it's so important to me, and I am so thrilled that we met, that we're together we'll go on this journey in Decatur and beyond. I mean, of course, you have patients that are outside of physical Decatur location. Patients come, I'm sure, from outside of Atlanta as well. And I know you've mentioned to me that you do have some ability to have telemedicine and conversations with patients. So we like to see patients, and we do have the ability to do that. And, you know, coming together, I think we could come up with some wonderful treatment plans.
Absolutely, absolutely.
Thank you
for having me
so much.
here.
I'm so glad that you come and visit our Atlanta office, and we'll take it beyond. All right, take care.